Thank you, sir. The slides you just saw really demonstrate a lot of things that we highlighted yesterday, and we will continue to highlight every single day about the vital role of flattening the curve. It is really important to continue to reiterate to the public that we are on the very front end of this situation, and now is not a period to be lulled into any sense of complacency. It is a period to know that these are the critical days where the actions that we take are the ones that will have the greatest impact. If we do what we should do, the greatest positive impact, and if we don't, the greatest negative impact on the potential of exponential growth as this spreads. And so we continue to ask the public to adhere to the stay-at-home orders, to the social, physical distancing orders, and to the steps we're taking. But the whole point of flattening the curve is to ensure that the healthcare system capacity is available for those individuals who need to be hospitalized as a result of that. And a second key component of our strategy and our effort is not just flattening the curve, but it is raising the bar of our healthcare system capacity. As we can provide more access to healthcare services with more rooms and more ICU beds and potentially more ventilators, as we can make these more readily available, it helps put us in a stronger position to mitigate our way through this crisis. And so today we have our Chief Medical Officer, Dr. Nikki Fentides, along with the CEO, Dr. Patrick Frias of Rady, to talk about a series of efforts that are being taken to raise the capacity of our healthcare system in a hope that can intersect with the need as we simultaneously flatten the curve. Some of these actions are taken by the county. We've been working with UCSD on taking an empty dorm and converting it into an alternate home care setting. This could be for an individual who's currently in a hospital who is not well enough to go home but doesn't need to be in the hospital. As we can potentially open new rooms that transfers folks out of a hospital, that is a room that could be available to someone else. There are efforts like we've talked about before with the expected arrival of a mobile field hospital. This is the equipment needed to actually bring online new hospital beds. And how we might do that, again, in close consultation with our healthcare systems. But our medical community and partners have been very engaged and very involved and very creative as we make an effort to take every possible step we can to have more healthcare system capacity available for our public. Before we get to them, we will do a quick update today. As we do every day, we did a series of sector calls. And these calls are important because every single day we're engaging with different members of the community, with different industries, different entities, different sectors to make sure that they're getting all of the appropriate information they need. They have a venue to ask questions, to request support and help. Today alone, we did a call with our binational partners, our military and veterans community, one with college students, one with emergency managers and public safety, one with elected officials and government representatives, one this afternoon with clinics, and federally qualified health centers, and Dr. Infantidis will do his clinical town hall. And this is just a snapshot into the daily action and efforts that take place driven by our Emergency Operations Center and everyone here to ensure that all of our entities and jurisdictions are coordinated, and those will obviously continue. Quickly, we will walk you through the now daily slides that we're going to provide to really document and chart the progress, and then our medical experts will be here to provide context to them as well as answering any questions. If we go to the first chart, this is simply the tracking of the cases reported in San Diego County. Yesterday's update, we reported 49 new positives, which brings us to a total of 297. We will continue to update this graph and chart daily. The second chart that we have available is the testing capacity. And again, I want to make sure we reiterate what we said yesterday. This is not essentially every test that's been performed in San Diego County. This is every test that has been reported to us. And we believe that all of our partners are getting into a better rhythm and system of testing. But total number of reported tests in San Diego County, 3,968, obviously with 297 of those positive. The next slide is an update on personal protective equipment that we have distributed through our Medical Operations Center. You will see here that to date, since we began the response to this crisis, we have distributed 423,805 N95 respirator masks, 109,550 surgical masks, 535 face shields, 964 goggles, 4,960 gowns, 3,600 gloves, for a total of more than 500,000 individual items of personal protective equipment that we have distributed. We will continue to fight to get more with requests to the state, to the feds, along with our efforts to purchase available supplies that are out there. And we will continue to fulfill every request as best we can based on the need, the availability, and the burn rate. And our Medical Operations Center continues to work very hard to try and do that. Another issue which we've talked about a lot is the motel rooms that are available. If we go to the next slide, these rooms are designed to serve two purposes. The public health rooms, which you see represented on the side of the chart there, 1,810. These rooms are available to any individual who is a positive test, is a person under investigation, or is an individual with symptoms awaiting further evaluation who do not have the ability or capacity to self-isolate. As we expect the numbers to continue to increase, the need for these rooms will become much greater. And so we moved early to secure them, not only secure them, but secure meal contracts, transportation, security, janitorial, laundry, along with the capacity for daily wellness checks. But out of these public health rooms, 85 of them are presently occupied. And again, as we expect a significant increase in the number of cases, we expect a significant increase in the need for these rooms. If an individual tests positive and they live in a one-bedroom apartment with 4 other people they cannot isolate, these rooms would be appropriate to help slow the spread and the contagion, or obviously any individual who is unsheltered and has no home to go to. Out of the 85 rooms that are occupied, 73 of those are occupied by unsheltered individuals who have been referred to us via our public health nurses, either through our homeless outreach teams or through the shelters. We have given 216 of these rooms to the Regional Task Force on Homeless. 154 of those are occupied. These are rooms for individuals who are homeless who have no symptoms, but they are vulnerable. They are vulnerable because of their age or their underlying health condition. These are individuals who would be most negatively impacted, and we want to make sure that they are in an isolation in a non-congregate care setting. We are going to allocate 221 additional rooms to the Regional Task Force on Homeless that will be reflected in tomorrow's chart, and we continue to work collaboratively with them to make sure that we get them the rooms that they believe that they can fill. The next chart represents some of our outreach efforts. To date, since the second week of March, 211 has received 53,397 calls. Out of these calls, 1,266 have been referred to our nurse triage line. This is the nurse staffing that exists on 211, and we will continue to track and monitor that. We've installed 257 hand washing stations. We have more that have been requested, and we are in the process today and tomorrow fulfilling those requests. On the county's website, coronavirus-sd.com, you can actually see a map that will show you the location of all of the hand washing stations that we have distributed to jurisdictions throughout San Diego County. Our homeless outreach teams, which are out daily engaging with unsheltered, have distributed 1,785 hygiene kits. We are assembling more and will continue to distribute those. And we are in the process of distributing public toilets in areas where we think that there is a need, and we will keep you posted on the progress of each of those. So having concluded the kind of daily rundown, I will now turn it over to our Chief Medical Officer, Dr. Nick Infantidis.